I'm going to talk very briefly about why health professionals should spend more time unlocking patients' common sense beliefs about their illness. So I guess just to give you a little bit of context, if you think about how we train medical students to be doctors, they spend a lot of time learning how to diagnose the problem the patient has, and then they spend most of their time doing that and then telling the patient what to do. I'm going to suggest that we need to do a little bit more than that. So to give you the example of asthma, the doctor would think that what happens when you have an asthma attack is you get constrictions in the lungs. This causes 3 symptoms: tight chest, cough, and wheeze. And if a patient's asthma is not well controlled, they should use their beta agonist or their reliever medication to relieve that problem. Now, at a very simple study we did a few years ago, we got patients to keep diaries in terms of their reliever use, their symptoms, and their actual lung function as well. And what did we find? Well, what we find that patients weren't using these 3 symptoms to decide whether to take their relievers. They had a whole raft of symptoms that they used to decide whether or not they should relievers, including things like sore throat, body tension, pounding heart, which are more related to distress, and their reliever use was completely unrelated to their actual lung function. So patients used their own beliefs about their symptoms to overuse medication in this case. In other studies, we've shown they use these beliefs not to take the medication at all. But the illnesses I'm particularly interested in, work I've been doing for a number of years, is trying to understand why people sometimes have persistent physical symptoms when there doesn't appear to be any overt underlying pathology or anything happening on an anatomical level to explain the symptoms. And what we've done here is we've taken people with an acute illness and we've looked, can we predict who then goes on to develop a chronic condition? And we found that if we measure people's beliefs about these acute illnesses when they're acutely ill, in terms of will this illness be serious, would it last a long time, is it out of my control, is the illness distressing, this, in every single study that we've done, it predicts whether people go on to develop new onset chronic problems. So in the case of Campylobacter, which is a nasty food poisoning, people 6 months later who had these beliefs developed irritable bowel syndrome, or more likely to develop irritable bowel syndrome. Those with glandular fever were more likely to develop chronic fatigue syndrome, and those with a mild traumatic brain injury were more likely to develop post-concussion syndrome. Importantly, we also measured a number of the other usual suspects in this area, like anxiety and depression and so forth. And although those things also were important, invariably the most important predictor was these negative beliefs patients had about their symptoms. So knowing how patients think about symptoms might not only help us understand their behavior, but it might also help us understand why they have ongoing symptoms. So I guess the next question is, can we do anything about it? Can we change beliefs? And if we do change beliefs, does that matter for patients? Well, we've developed a number of interventions specific to the models that we've worked on. So, for instance, we've done a randomized controlled trial of cognitive behavioral therapy for people with irritable bowel syndrome, and we've shown this is effective in reducing the severity of the IBS symptoms and also effective in reducing the disability. Similarly, we've used this to treat fatigue and multiple sclerosis. So we find that actually if we use interventions which focus on helping people think about their symptoms and illness differently, as well as behaving differently in relation to these symptoms, we can improve the clinical outcome for these patients. We also then go on in these particular studies to look at what's the mechanism of this success. Why are these patients getting better? And again, fairly consistently, we find the most important mechanism is that people develop more positive views about their symptoms, more positive views about their illness. So they change this very negative way of thinking about the illness. And again, importantly, because a lot of people in these areas tend to think it's all about mood, it's all about depression and anxiety. If we get rid of that, then these things will stop. But in fact, we find that it's not, that actually we don't have to treat or even change people's anxiety and depression in order to reduce the severity of their symptoms. So what's the take-home message? I think the take-home message is, rather than always telling people what to do or telling patients what's wrong with them, spend a bit of time finding out what the patient thinks is wrong with them, and then use that information to develop a collaborative approach to look at what might be the best way forward. Thank you very much.